Hi, I'm Dr. Tasman Cordy from Sage Nutrition in Little Silver, New Jersey. And if you've been concerned about your pre-diabetes or diabetes-like conditions or even a diagnosis of type 2 diabetes, it's time you get tested. We do 3 different kinds of testing in our office so we can figure out how we can get you better and out of that pre-diabetes or diabetes diagnosis, hopefully off of some of the medications you're taking to control your blood sugar and back to a lifestyle and diet that controls it on its own. It's entirely possible to do. It's not always easy, but we start with doing food sensitivity testing. One of the things that we've seen over time is that when people are sensitive to certain kinds of foods, like gluten, for instance, or eggs, or very common things that we think are good for us, maybe even some kinds of fruits or milk, dairy, things like that. If particular bodies or particular people are sensitive to those kinds of foods, it may cause problems for you. It causes inflammation that starts decreasing the ability of your pancreas to function properly, to create insulin, to balance that with glucagon, and then your blood sugar starts to get out of control. You feel hyper or hypoglycemic. You get those leaps and bounds of blood sugar regulation problems, and you start feeling pretty crummy, and over time, that gets worse and worse, especially if you're still eating those foods that you're sensitive to. And it's not always a common sense kind of thing what you're sensitive to. Some people, even in your own family, might do really well with certain kinds of foods and you might not. And over time, it may end up that you are the one who gets that pre-diabetes or diabetes diagnosis because you're the one who's sensitive to these foods that you're eating or overeating, causing the inflammation in your system. So first we need to do this food sensitivity testing to figure out what you're sensitive to, what we need to remove from your diet. We put you on a customized diet that removes, again, the foods that are causing problems for you. And that inflammation, once we calm down and quiet that inflammation, your body's able to start repairing itself. So we take a look at that. The second thing we're going to take a look at is nutrient deficiencies, because we know if we overeat certain kinds of foods, we create nutrient deficiencies. For instance, if you're overeating a lot of fruits or carbohydrate kinds of foods, we blow through our B vitamin supplies, our magnesium supplies, and sometimes our zinc and selenium, chromium. All those get depleted, and we don't have enough of them to process normal foods that we eat on a daily basis, and we need to replace those and replenish those deficiencies so that our body can function properly, and again, it can repair itself and get out of that diabetic crisis or pre-diabetic crisis back to a place where your body can be able to adjust itself and control its own blood sugar on its own with just taking care of diet and, again, lifestyle. Maybe it's sleep hygiene. Sometimes people just don't sleep very well, and we fix the sleeping issues with a variety of different lifestyle things we can talk about, and then the diabetic condition gets better. And we know that if people don't sleep for several days in a row, we start to see signs of blood sugar handling problems. And so that sleeping component is really, really important. And the third thing we do in our office on a visit-to-visit basis is we do a testing called nutrition response testing. It's a biofeedback kind of testing. We make sure we know which organ systems need the most help and which kind of help they need. So if they need more B vitamins, if you need more minerals, if you need more fatty acids, we check all of that. We put all of that information together and put you on a customized plan to get you all the way better. So call our office at 732-852-7752. We can get you in for a free consultation and take a look at where you are and start to get you on a customized plan to get you back to normal, back to better, and back to feeling like you want to feel again on a daily basis. Thanks.